All right, welcome everyone to DACA to Doctor. My name is Ogechi, and I'm so excited that you've joined me today. I have a very special guest with me. Well, I feel like I say that about all my guests because they're all so special, and I'm always really excited that anyone makes the time to sit with me and chat for all of our benefit. But this is my friend, Dr. Daniel Bedney, who I actually haven't connected with in a very long time. So I'm really excited to have you here with me. Thank you for joining me.
No
Um,
problem.
Absolutely. Can you just kind of tell the people who you are, what you do, where you are, all of those things?
Yeah, for sure. Thanks so much for having me, Ogechi. Man, it has been a while. I
Hmm.
think we were talking like 10 years or so,
Yeah.
easily. So it's good to be here with you. And first off, congratulations to you and your journey
Thank
and where
you.
you are. And so happy for you and what you're doing. Uh, I'm Daniel Bedney. I'm a primary care sports medicine doctor in Orlando, Florida. I am been practicing for 6 years now, and it's a lot of fun. I work in academic medicine, so my 9 to 5, I'm teaching residents. I am pouring into them, pouring into our future family medicine doctors, and I get to teach them sports as well as family medicine. So it's a lot of fun.
Awesome. Just so you guys are aware, there is a sound that is kind of like going to be joining Danny and myself during this episode. So he does live in sunny Florida. There's a beach nearby. We're just going to imagine that those are waves crashing through. So just keep that in the back of your mind and just think of the waves, and that's what we're gonna rock with. We've been trying for the past several minutes to get rid of it, and it's the ocean joining us.
Just
So
here, you
just
gotta
it's here
embrace
with
it.
us. Just enjoy it along with us. Okay, so what is something you do, a gift or talent that you are proud of? And it may be something that is not a traditional gift, but what's something about you that you really enjoy about yourself?
Yeah, you know, I think I'm gonna go traditional.
Okay.
I'm big into music. I grew up in a family that music was a big part of our life. And I have a 1 year old son, and we were just before this, we were dancing to Michael Jackson's Billie Jean. He loves music,
Yes.
and music is just a part of me, and it's a big part of me. And I think I'm realizing more and more how important music is to me
Mm.
the older I get, and actually, and the more I miss it, actually, because you can get so busy in medicine, in your career and stuff, that you forget about the things that kind of rejuvenates you and stuff. So
Hmm.
I actually incorporate music into my lectures. So I actually I'll summarize a lecture by spitting a couple bars.
Okay.
Actually summarize it. Um, written bars. Don't ask me to freestyle. I
I
don't
was
have
gonna
that skill.
say
I knew it
maybe
was
at
coming up. It always comes up, but no, it's written. So
well, I was gonna say at the end of this, if you wanna take some of what you've said, put it in a little bar, like I'll back you up. I'll put myself on the spot. I'll drop a beat.
yeah, we can think about it.
Okay, maybe I'll have you back. We'll have a little bonus episode where you come and drop a bar, and I'll back you up on the beat.
We can work it out.
Okay, I feel like he just committed, guys. So stay tuned. So speaking of music, if you weren't in medicine, what would you be doing? If like funding and resources were just completely everything you needed, would you be doing something other than medicine?
Yeah, I would totally be on Broadway. I would be like,
Cool.
yeah, I would totally be on Broadway, like performing and stuff. Well, not now because of COVID, they're shut down.
True. Hmm.
But man, I always liked, to be honest, I've always liked musicals and stuff. I think
Yeah.
just my love for them has grown more and more over the years, and it probably I guess the fire got rekindled with Hamilton coming out,
Hmm.
and me just absorbing that. I don't think you ever, I'd never heard anything like that,
Yeah.
and I just enjoy the storytelling and stuff. And if you look on my iTunes right now, it's like a lot of Broadway stuff actually. People are
Oh,
like, "What you listening to?" And I'm like, "Dear Evan Hansen, um, or Hamilton, or
yeah.
Wicked, or all these Broadway shows and stuff." So definitely, if I could didn't if I was doing something else and had unlimited resources and stuff, I'd probably go for that.
Is Hamilton your favorite Broadway show?
Yeah, it
Yeah.
really is. Probably Wicked is really good though as well. I enjoy that one. as well. Out of the ones I've seen, those are probably the best ones that I've seen.
Yeah. Ooh, I have a secret. So I've seen Hamilton. I think I've seen Wicked too, but I went to see The Lion King
Yeah.
and I fell asleep.
Oh, is it because you felt like you knew the story already?
No, 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 no. It wasn't that. I was just so tired. And like no one will ever let me live it down. And fun fact, it's not the only thing that and it's not the only show, like major show that I've seen where I've fallen asleep. It's really
Hey,
bad, but like everyone holds it against me. And I'm like, I was tired.
you're sleep deprived. Yeah,
Sleep deprived.
absolutely.
Um, okay, so thanks for sharing that. I actually wish I had known this about you back in the day because I would have like just had you on speed dial for every performance and for everything. Because you remember back then I was like
Yeah,
doing
for
a
sure.
lot and always looking for people to do stuff. But you were in med school too.
Well, I think that's what I mean by it. I think I was just consumed with becoming a doctor
Yeah,
and wanted to focus on med school. And med school is hard in and of itself. So to add extra stuff to my plate
sure.
was just something I wasn't willing to do at that time. But I kind of wish I had, because I think it would have grounded me actually, and
Yeah.
probably would have given me an outlet that could have been healthy.
So can you share your path and your timeline to medicine? Actually, first of all, when did you know you wanted to become a doctor and why? And then kind of go into how you got to the point of where you are right now.
Yeah. So my grandfather was a family physician, actually out in California, out in LA. And I grew up, my uncle went to med school as well. My aunt's a physician. I grew up with doctors in my family, but I never really wanted to be a doctor just because um, they told me, hey, you'd be good at this and stuff. So I actually went to a summer program at Loma Linda University, which is actually where I ended up going to med school, called the Minority Introduction to the Health Sciences, or MITS.
Hmm.
And that happened in between my junior and senior year of high school. And that program, we got to like experience a little bit of med school, and we got to take some courses. And I did very well in them. But what I realized was I loved the human body.
Okay.
Um, and it was like a puzzle to me, and it just fit perfectly together. And I was like, man, this is so cool. This is so dope. And then I actually talked to my uncle who went to med school, and he was like, you know what you should do, Danny? Um, you love sports, and now that you love anatomy and stuff, like I think you'd be good at sports medicine. So that's where the dream started. When I was a junior, well, going into my senior year of high school, I was like, I want to be a sports medicine doctor. Didn't really know everything that entailed, uh, but I was just like, man, I'm going to be a sports doctor. So I knew that for med school, I'd probably have to, get an undergrad degree and stuff. So I went to Oakwood University. I majored in biology just because that's what everybody does that's supposed to go
Yeah.
to medicine. And I did that, and I wanted to quit biology and go into business, but through circumstances, I stuck with it, and I felt like the Lord was calling me to be a physician. So took the MCAT, didn't do well, like a lot of us do.
Yeah.
Didn't do well. So I went to a summer program actually at the University of Michigan, helped me get my score up.
Hmm.
Um, and then got the score that I needed, and then I started applying. And I actually I got into 3 med schools actually. I was
Okay.
set I was set to go to 1 med school. This is a crazy story. I was set to go to 1 med school, and I sent off my letter of intent. The day that I sent off my letter of intent, I got about, I kid you not, 5 or 6 phone calls from different people from different aspects of my life telling me that I shouldn't go to that school and I should go to Loma Linda University. And they thought that's what would be best for me. Um, and so I took some time after that to just kind of pray. And then I was like, man, I think I should go out to California. Actually, some of my boys were just going out to California because they were from there and they were going back home. I was like, that would be dope. That'd be cool. So I went out there. And then I was in med school. And med school was the hardest thing I've ever done in my life. It wasn't easy. I think that it was a wake up call. It was a very humbling experience.
Yeah.
I always tell people I thought I was smart until I got to med school.
Story of my life.
So, I can remember my first test, man. I think I got like 75% or something. And I thought it was on the curve. So I was like, oh man, I'm doing pretty good. And then I looked at my class ranking and I'm like 33rd percentile or something. And I'm like, man, okay. Those people, people are just getting the hundreds up here. Like the curve is 100. So
people were getting hundreds.
Oh yeah, for sure. For sure. Actually, one of them was my friend. It was crazy.
It is hard when you look around you and like your people are doing better than you are. It's like, okay, Jesus, what's going on?
That's what happens.
For me, that's the worst, actually.
I think to get to med school too, you have some level of competitive of a competitive nature.
Mm-hmm.
So you're comparing yourself to everybody else.
Yeah.
But what I realized in med school though was what's going to make me a good doctor is not the same thing that's going to make my classmates good doctors. So you kind of just have to pour into what's going to make you a great doctor. And once I realized that, I think I started to blossom and kind of grow and stuff. But, went through med school, passed step one. Passed step one, passed step two, didn't do as well as I wanted to do.
Mm-hmm.
And because of that, because I didn't do as well as I wanted to do, I kind of let go of my dream of being a sports doctor for a couple months. And I was actually going to be a psychiatrist because I do enjoy the mental aspect of medicine. And I think that it's kind of untapped. The brain is kind of it's really, we don't understand it as much as we think we do. So I was very interested in that. Dr. Ricardo White was one of my mentors, and I really vibed with him. He's an addiction medicine specialist, and I was like, yo, I'm gonna do addictions. I'm gonna make 6 figures, and I'm just gonna sit in my cardigan and talk to people, and I'm good. But I did a rotation in family medicine, and I think what really was lacking was my confidence. And I did a rotation in family medicine, and I realized I missed my stethoscope. But more importantly, I realized that I could do it.
Yes.
That I could actually take care of these patients. I could do family medicine, and I wouldn't have to let go of my dream of being a sports doctor. So then went for family medicine, and I was dating my girlfriend at the time, who became my wife, and we couples matched into family medicine at Florida Hospital in Orlando, Florida, and had fun with that. But residency is hard as well. So actually step 3 came, and I kind of didn't study like I should. And I failed it by like 2 or 3 points. So I had to retake that.
Wow.
And that was really, that was painful because I thought I had ruined all my chances to be a sports doctor. I was like, what fellowship is going to want me if I failed step 3? But, passed step 3 and then applied to sports medicine fellowship and got into sports medicine fellowship at Meharry Medical College in Nashville, Tennessee. Did a year of that. And then I came back down here, worked outpatient for like 2 years, and then was kind of stressed out with the outpatient, doing family medicine, trying to grow sports, but was coming home with like 30 charts, was doing 30 charts on the weekend, wasn't good for the home life. And then my program director from the residency me and my wife graduated from called me and said, hey, we have an opening for a sports doctor, a sports faculty member. Are you interested? I said, absolutely. Interviewed, and now my life is fantastic. I'm living the dream.
Wow. Okay, I have so many questions. So
I know that was a long story.
No. It was great. It was great. Thank you for sharing all of that, because I know that sometimes when you have a goal, like I'll speak for myself, I had this goal of getting into medical school, and it's like you can sometimes be so consumed by that, and then when you get in, it's almost like you're not prepared for all the other things that could happen. So like there'll be setbacks along the way. There'll be hurdles you have to jump through. There'll be there'll be shifts and things that you're not prepared for. And so I think it's really important that you shared not just, so I went to med school and then I did a residency and then I did a fellowship and here I am, but you shared that you failed an exam and you probably failed more than one, and things were good, things were bad. But also, this is what I wanted to ask. How was the experience for you and Lauren both kind of like doing the same things at the same time and, hoping to get matched in the same place, and how was that experience compared to perhaps maybe someone else who would, I don't know how to ask this because like this is your experience, so I don't know how you would
Mhm.
know. But there are people who say I would prefer to be with someone who is not a doctor, who is not in the same field that I
For
am.
sure.
Like how was that for you guys, both navigating those things at all at the same time, and then
Yeah, so
starting
I
a
was
family and
absolutely. Yeah, I think that, so first off, I didn't want to marry a doctor. Like, I
Mhm.
never thought I would marry a doctor. I was like, I need to marry somebody. Outside, it's going to be too hard. I think
Yeah.
there's even statistics on doctor couples and like the divorce rates
Mhm.
higher and
Mm.
stuff. But, I think in life, what happens is I think you're around people that are similar to you.
Yeah.
And uh, my wife and I, we actually sat together all the time in class. She was dating somebody the first couple years. I was dating people. Um, so we were just friends, and we didn't
Okay.
even think about a relationship until our third year, I think. And our third year, we actually had all the same rotations. We were on the same every rotation together. So we
Hmm.
saw each other a whole lot, and we looked out for each other. Uh, and we always looked out for each other just because there were not a lot of people that looked like us.
Right.
But also a lot of our friends that started with us, they didn't end with us. So we
Mm.
just kind of kept on trekking through together, actually. And some of our friends, they still finished, but they kind of took a different route and stuff. So
Sure.
we were kind of the ones that remained, and then we stayed close. And then my best friend was like, I think you should talk to Lauren. And I was like, we're friends, but best decision of my life to have that awkward conversation with her. And then she was down for it. And I think that we've been able to support each other
Hmm.
because there's understanding um, that we both work hard. Um, we're both physicians, um, and it's an understanding that we have to work together
Right.
to make this happen. We have to work together to make each other's dreams come true, um, and we have to support each other. Having a kid is definitely difficult, but um, we adjust our schedules so that uh, we can we can be here as much as possible,
Hmm.
um, and we just roll with the punches. And it's nice to have somebody that understands
Right.
what you're going through.
Okay, so there you have it, folks. We brought it back. At first we talked about statistics, but don't break up with Dr. Bay yet. Don't do it. At the end of the day, I think it's important to have someone who understands you, the person, you, not necessarily Dr. Bedney. So I earlier you were kind of like bragging on your wife, and I thought it was really, really beautiful. So I'm going to give you a few seconds to go ahead and talk about Lauren real quick and what she does at work and how she wins all these awards.
For sure. Yeah, yeah. My wife is awesome, man. She is I didn't even get to work with her until we did a rotation in Guam.
Okay.
Even though we did residency together, we were never really together um, as physicians. So we went to Guam, and it was actually a month after we got married. We had
Hmm.
autonomy with our patients, so we were kind of just there just wasn't as much oversight. So I got to see her as a physician.
Hmm.
Man, I told her one day, I was like, babe, like you're really good at this. Like
Yeah.
I didn't really know, but she's awesome. She's working here in Florida. She works outpatient. She's a family medicine doctor. Her patients love her.
Hmm.
She gets the highest scores for press gaining.
Oh, that's
Um,
dope.
like she's getting awards left and right. They want her in committees and stuff. I mean, she's a rock star, and she's amazing. And I'm just blessed to have her in my life.
That's awesome. Thank you. Thank you for sharing that. So back to sports medicine.
Hmm.
I know I was telling you earlier that I actually don't really know anything about sports medicine. And I know you're doing academic medicine now, but what really is sports medicine, and how does one know that perhaps that's something that they should, get into? Also, who should not get into sports medicine?
Yeah. So so sports medicine. I'll just talk about primary care sports medicine mostly.
Okay.
So primary care sports medicine is non-surgical orthopedic medicine.
Okay.
So think of everything an orthopedic surgeon does besides surgery, and
Hmm.
that's usually what we do. So my job is to take a patient um, and do everything that they need before surgery. So let's take arthritis, for example. Arthritis is not necessarily sports related, but let's just talk about it. Or let's talk about meniscus injuries. That's
Okay.
more sports. A meniscus injury, somebody has a meniscus tear. They may be like a weekend warrior, so they just work out on the weekends. Physical therapy has been shown to be as effective as surgery. So I would diagnose them, try and take them through physical therapy, try and rehab them. And then if they aren't improved, I would say, okay, go see the orthopedic surgeon and maybe talk
All right,
about
real quick. Physical therapy is as effective as surgery for meniscus injuries.
for some of them. Now,
some
if
of
they're,
them.
if they're
I
like,
just didn't want to have anyone to pick up that soundbite and generalize. I don't need surgery. I just need physical therapy. You're speaking.
yeah, I mean, disclaimer, go see your doctor. Like, don't be listening to this podcast like, yo, this is what Dr. Bedney said.
Right.
Or this is, don't do that.
Sure.
So go talk to your doctors for sure. But I try and take them through those conservative measures first, whether it be steroid injections, whether it be viscosupplementation for arthritis. And I just try and take them through those things. That's one aspect. So that's the clinical aspect. But then also, I really just specialize in taking care of athletes. So I cover a couple teams in the area. So I cover 2 high schools, and then the Orlando Magic G League affiliate. They're called the Lakeland Magic. So they're professional basketball players that I take care of as well. So we specialize in taking care of these elite athletes and injuries that they experience, but also the nutrition and the exercise physiology and all that stuff that they do as well. So we cater to them.
That's dope. And so you mentioned earlier that you love sports, and so you wanted to get into sports medicine, and you had an uncle that kind of guided you down this path. Who should consider sports medicine, and who should perhaps think about something else?
Yeah, so I think so you definitely have to love sports, and you have to be okay with working on the weekends, because that's when sports happen in high school. You have to not mind it. So for me, I knew sports was right for me when I was in residency, and I would work a full day, like, 7, wake up at 7, go to the hospital, whatever, round and everything. And then 7:00 would come, and I would have to go cover a football game. And I wouldn't be tired. I would actually be energized. It was like the dessert. I was like, yes, I get to go cover a game. And that was so exciting. And fellowship was just so exciting. I was like, oh man, I get to go cover this game. I get to go cover this game. I get paid to watch sports. This is awesome. So that's who really should do it. Also, if you're just interested in exercise as medicine. So, I mean, a lot of what I do too is just trying to get my patients to be a little more active or keep them active.
Yeah.
Because I'm a family medicine doctor, right, too. So the number one killer of Americans is cardiovascular disease. This is preventative. If we can get people active, then we can actually reduce the morbidity and mortality of cardiovascular disease. So that's one aspect. You should not do sports medicine if you don't want to work on the weekends, but also if you don't really vibe with anatomy. Anatomy is so key.
So
anatomy is so key.
Benny, that just feels so personal right now. I just feel like you're talking to me. Like anatomy.
Specifically MSK, because it's bread and butter.
Kind of like MSK, but carry on.
Yeah. So, I mean, it's MSK anatomy. So I always tell my residents, where you touch and cause pain, that's probably the reason why they came. So, I mean, you have to know the anatomy and stuff. So if that's not your strong suit, you can learn it and stuff, but then you may want to go in a different direction. But probably more important is lifestyle. So knowing that, hey, my weekends and sometimes the holidays may be filled with sports coverage, then you may not want to go this route.
Well, that's good. That's actually really, I think those are really key points. It's also important, speaking for myself as a first year, every time I listen to someone talk about their specialty and what they do, I'm like, that actually sounds really, really good. Or sometimes I'm like, that doesn't sound like anything. But I think it's important for all of us, speaking to anyone who's either pre-med or, first couple years, to keep an open mind, because you never know what you're going to end up falling in love with. And if you just kind of rule out certain things and maybe have your heart set on one thing, you could actually have your heart broken. I've had people say, all my
Mhm.
life I wanted to do this. And then I actually started, like shadowing, or I had a rotation and it was trash. I hated it. And then I
Yeah,
just felt lost. I didn't know what else to do, versus those who are like, I kind of know what I want to do, but I'm keeping an open mind. And so they're
yeah,
really able to have a really well-rounded experience because they want to learn. They want to know what's out there and what's best, what suits their personality best.
absolutely, absolutely. You got to keep that open mind. When
Yeah.
you're in med school, you got to just learn as much as you can and
Hmm.
learn about different specialties as much as you can, and even do your electives and stuff to
Hmm.
really get a feeling of what it's like, for sure. I will
Yeah.
give this hint about family medicine, okay, family medicine specifically, because I'm a family medicine doc first. If you do every rotation and you're
Hmm.
like, man, this is cool, this is cool, this is cool, I can see myself doing it, then family medicine may be a good field for you because we do a little bit of everything.
Sure.
So, uh, I would do a rotation. I'd be like, oh, this is kind of cool. Oh, this is kind of cool. I can see myself doing it. So that's just a little tidbit. That's my 2 cents.
Noted, duly noted. So tell me a little bit about the academic part of what you do. How did you know that you wanted to get into kind of like training? Because you train residents, right?
Hmm.
How did you know
Yeah,
that's something you wanted to do?
I always loved teaching. So I always loved. I just admired when I was in med school, like the teachers, and I just thought they were so knowledgeable. Um, and I always thought that teaching is actually one of the best ways to learn. So
Hmm.
even in med school, even though I wouldn't say I'm the best student, but people would come to me and I would enjoy teaching them. I mean,
Yeah.
I even go back to high school. I used to tutor people. College, I used to tutor people. I always loved teaching and that light bulb kind of turning on.
Hmm.
So I always thought I was going to get into teaching eventually, but I thought it was going to be when I was like 50, kind of like after I had all this experience. And then I would just come in with my gray hair and just be like,
Yeah.
let me just teach you something. Um, but I was so burnt out just doing regular family medicine and trying to grow sports. Um, that when the opportunity came, I was like, I have to pursue this, and I think I'm ready. Um, I think I have some knowledge to give, and the beauty of academic medicine is that we all learn. So
Right.
the residents are teaching me. We learn together. I always tell them, "Hey, let's learn together." If I don't know something, so the academic setting is just uh, it's a great setting because it just fosters learning.
And how important is it to you to just kind of be a representative, especially for Black people and Black men specifically in medicine, where the numbers are so low? One, even just applicant numbers are low, and then the numbers of those who end up being students, and then especially in academia, I think majority of us can count on one hand how many teachers and professors we've had who are Black men, or even just Black people in general. So how important is it to you to kind of be that person that is the one, or one of two that people can look up to and say, oh, Dr. Bedney, he's a Black man and he's looked out for me, or like I look up to him. What does that mean to you to be able to do that?
Yeah, it's a very humbling experience, and it's kind of why I do what I do in some regards. So, um, just talking about sports medicine, one of the reasons why I really like sports medicine is because who plays sports?
Right.
Um, a lot of African American males play sports, and while I may not be able to connect with them on different levels, I can go meet them where they are, and they can see me. I remember I was in the training room dealing with some football players at the high school, and they were like, "Man," they were like, "Dr. Bedney, how much money do you make?" And I was like, I actually answered them honestly because I want them to see that I'm just like them, and they could actually do the same things I'm doing. Um, so I want them to have that experience. I want them to be able to see somebody on the sideline that isn't a coach, that
Mm-hmm.
is still in sports, that's doing stuff, um, and just give them exposure. And I think the same thing's true for academic medicine. I want people when they interview to see, there is somebody that's like me here,
Right.
and somebody can understand what I'm going through. Um, because the Black experience in America, you don't have to explain it to me. Like, we don't have to explain it to each other. We already get that.
Mhm.
So we're already on the same level. We're already on the same wavelength. So now we can move past that and we can kind of connect on other stuff. not
Right.
everybody that doesn't experience being Black in America understands that, and it may be some more barriers to the communication and experience. I mean, I can count on one finger the number of, I think it was just Dr. Ricardo White, who was the only Black male attending that I worked with in med school.
Wow.
And then residency, Dr. Curtis Weaver was one, and Dr. Ulrich Simmons. So two Black males there, and Dr. LeCount. I'd be remiss if I don't mention her, but she did an awesome job in med school too. But it was very, very few. But those were people that I could lean on, that would understand me, that we could we could have some real conversations. It was just powerful. So, I look at it as a very humbling experience. I have a great relationship with all my residents, but you definitely tell a difference when somebody that looks like you comes into my office.
Sure.
And one of the residents comes in, and they can be real with me. I can be real with them, and I think we grow together.
No, that's dope. Thank you. One of the things I wanted to ask, which I think you actually addressed earlier, is the importance of making sure that you have extracurricular activities and hobbies and other things that you do besides medicine. How important was that for you when you were a student and even in residency, as busy as you were? And how important is that for you now? I know you mentioned singing, but is there anything else you do that kind of gives you joy and feeds your soul?
Yeah. So, I mean, before COVID, it would be hooping. But, during med school, I was at Drayson Center on Loma Linda campus playing basketball.
COVID, man.
Almost every day, I think, really. And, I'd feel kind of stressed, and I would just go play ball for an hour and be able to get back into it and study and stuff.
Grayson's been shut down since last year because of COVID. I think it's open now, but you have to make appointment.
Yeah.
It's just weird to see it so quiet and not packed out like always.
Oh man.
Yeah.
That's crazy. So staying active, trying to stay active with that. You got to make time for that. And I mean, I think as my education's gone up, my activity level has gone down. So, we try and find 30 minutes here and there to get active. I was just on the Peloton before I hopped on this joint, but I hadn't done it in a while, so I just had to slow it down. But we just try and just work it in as much as possible. But other things, for me, my spiritual health is very important to me. So I'm actually an elder at my church. And so if I'm not growing spiritually, I don't feel whole.
Yeah.
So if I'm not serving, I don't feel whole. So I really enjoy serving at the church and public speaking and stuff. And that's how I get filled spiritually and stuff. So it's important to have a balance. And I think the reason why it's important to have a balance is so you can connect with your patients. Nobody wants when you have diverse experiences or different hobbies and stuff, it's easier to connect with people because your world is broader. So I think it allows you to just connect.
All right. So a couple more questions. My channel is built specifically for people who may have challenges getting into medical school, or maybe who just need encouragement in their pursuit of medicine. What would you say to a young man or a young woman who thinks that they might want to be a doctor, but they are intimidated by the long years of training, the potential huge debt that they will incur, and the amount of sacrifice it takes, or maybe they just don't have anyone in their lives who can kind of be that role model for them. And I know that watching people on YouTube helps, but it's not the same as having someone who's pouring into you on a regular basis. So I definitely acknowledge that this is only helping a little bit, but we're trying, we're trying to do something. So what would you say, what little tidbit do you think someone can take from this, a soundbite to kind of encourage them?
What I tell a lot of people that ask me about med school and the time and stuff is, I've learned in life that time is going to pass no matter what. So if you don't pursue medicine, if you're just working your regular jobs or whatever, time is going to pass no matter what. And you'll end up being 45 and doing jobs and stuff that you don't enjoy and stuff. So you might as well use that time working towards a goal and a dream that you have. And dreams aren't dream. If you're achieving all of your dreams, then maybe you're dreaming too small.
Ooh, say that again.
So, I mean, if you're achieving all your dreams, then maybe you're dreaming too small.
Wow.
So dreams are supposed to be big. Dreams are supposed to be huge. They're supposed to be the unthinkable. And dreams are worth fighting for. They're worth enduring. So, if you feel called to be, or you feel like, man, I really want to be a physician, then go for it. Time is going to pass no matter what, and just go at it with all your heart. It's the hardest thing I've ever done in my life, but it's also the most rewarding thing I've ever done in my life. To help patients, to have an opportunity for them to open up a piece of them to you is something that's precious, and it's very humbling, but it's very rewarding as well. As far as the debt goes, yeah, you're going to be in debt for sure, but you're also going to make six figures right off the bat. So, I mean, if you're smart with your money, you'll be able to pay that off for sure. No doubt about it, but you just have to be smart with the money.
Yeah.
I work with athletes and stuff, and athletes get a bad name for being bad with money. But you know who else is bad with money? Physicians. We're terrible with money. So, because once you're a physician, you can get anything you want to get. Like, you can literally go, after you're a physician, you can literally probably go to whatever car lot you want and be like, what do you do for work? I'm a physician. Oh, we can get you in a car today. Right. So you can make all those bad decisions and stuff.
Yeah.
But I wouldn't let the money be the things that stops you, because I think you're going to make it back. And if you'll make enough money, and if you just make the right decisions, you'll be able to pay off that debt. And there's loan forgiveness stuff too, if you work at an underserved area, which a lot of us do actually. So, there's stats on why we need more Black physicians. And one of the reasons is we are more likely to actually work in areas that are needed, in underserved areas. Why? Because that's where our people are. Absolutely. So you work in those areas, you work for 10 years, boom, your debt is eliminated. And it's probably somewhere where you would want to work anyway. Mm-hmm.
Very good. Thank you. And for myself, I would say one of the things that has been a bedrock for me, a foundational part of this channel, is that I really think that life is best lived when we live in community. And so the reason I started this was to, kind of put myself out there and say that, I've been through certain things, and I am willing to stand in the gap and just be, I can't be a lifeline because I'm a student as well, but also just to kind of point people towards resources and to show people that, closed mouths don't get fed. You got to open up your mouth and ask questions. You got to talk to people. You got to get on Google. You got to write letters and apply for the scholarships and knock on doors repeatedly and jump through hoops. Like, you have to do that. Yeah. I always say that I don't want us to glorify the struggle. I do not think it is okay that certain people have to work 10 times as hard to get into certain things and to get where they need to be. I don't think that's okay until the time when we're able to really kind of like make things more equitable. Some of us do have to work a little bit harder. And so I'm here to say that it is, as kind of echoing what Dr. Bedney is saying, it is definitely worth it. But ask for help, talk to people, ask questions. You guys know I'm open. I respond to your emails and, willing to point you in the right directions, or at least to people who might know one or two things. So keep pushing. Don't give up. It is worth it. And if nothing else, even if you don't get to where you're trying to go, there's that feeling of, man, I was obedient to the calling on my heart. I was obedient to God. I was heeding the voice of the Holy Spirit. And at least for me, it lifted a lot of burdens that I was carrying, because I just kind of knew that I wasn't doing what I was meant to do. And I was kind of like stuck looking at all the no's and all the closed doors. And it's like, well, have you tried to push through? So being obedient is worth it. Trying your hardest is worth it. And if you don't get to where you're going, where you're trying to go to, just kind of walking that path, you will land you might find something else that maybe is even more fulfilling that, than what you thought initially you were trying to do. So
Yeah, let me just echo that, because I just want to free somebody, because I think a lot of times we think medicine, I have to be a doctor, or I have to be a doctor, and that's the only thing that I can be.
right.
And the reality is, we're talking to people that, yes, I'm sure I want to be a doctor. But some of you guys are probably like, man, do I want to be a physician? And I would encourage you to really know what you want, because it is going to be hard.
Yes.
But if you want to do it, it's well worth it, right? But if you just want to be in healthcare and help people, there's other things in healthcare that you could do to help people. Or maybe there's finance or anything like there's just other opportunities. I'll use sports, for example. One of the things I love is just opening people's minds to the sports medicine. So I'm a physician in sports medicine, right? There's physical therapists in sports medicine. There's athletic trainers in sports medicine. There's GMs of teams. There's owners of teams, right? Everybody talks about LeBron James makes a lot of money, right? He does make a lot of money, but somebody pays LeBron, right? Steph Curry makes $40 million a year, right? That's a lot of money. No, somebody pays Steph $40 million a year. That's who has the money, right? So ownership, being a GM, being assistant GM, all these different things that we can be. I want to be in sports. Well, there's different opportunities that you can be in. Now, if you want to be the boss and be in charge of their medical, kind of be the go-to for their medical needs, then yes, be a sports doctor and stuff. But don't limit yourself just based on, I have to have this certain career. It's not necessarily true. But if you want to be a doctor, if you want to be a sports doctor, stick with it, man. It's so worth it. It's so worth it.
Oh my gosh, this has been so cool. Thank you. Thank you for coming, and thank you all for joining us. Actually, before we end, if someone wants to reach out to you and maybe kind of learn more about sports medicine or just get some encouragement along the way, how can they get a hold of you?
Yeah, sure. You can just send me a message on Facebook, Daniel Bedney. You can find me. There'll be my face there. Just message me. That's cool. Or Instagram, Dr. Coach 27. So Dr. Coach 27. And I just ask, my Instagram is private, so just DM me first, like saying, hey, I heard you on the pod, and love to talk to you. If you don't do that, you will be sitting in the inbox for a while. So just or the friend request for a while. So yeah, more than happy to chop it up with anybody that wants to.
Awesome. Thank you so much. And thank you all for joining us on this episode of DACA to Doctor. I don't know what I'm going to call it yet, but I feel like you said a couple of things that I'm like, I think that's going to be the title. So we'll see. Stay tuned for more. I have several physicians and med students and people in different aspects of medicine that I'm so excited for you guys to meet and hear their stories. And thank you for joining us, Danny, Dr. Bedney, myself, and the ocean, the Atlantic Ocean. We've been rocking together. So I think
I can't hear it, so I'm hoping that they can't hear it.
Actually, you know what? It's possible. It's very possible that they may not be able to hear
it's just you. You do have that super ear. I remember that from singing. Your ear is on point.
You're right. That is true. I remember where we would sing a whole line and I'm just like, something isn't right. There's one tiny little note that somebody's singing that I don't like.
It was probably me.
No. Sometimes. No, I'm kidding. But thank you all so much, and I will see you next time.
Thanks.